Welcome back to the final video of Chapter 7. We're wrapping up with a brief discussion of some common bone disorders. We'll be talking about several different types of bone diseases. We'll be talking about the different types of fractures that bones can have happen. We'll talk about how fractures are repaired and also some other skeletal disorders. A term here that's really important is orthopedics. Orthopedics is medicine dealing with correcting and preventing injuries to bones or joints or muscles related to bones. In the name orthopedics, we have ped, so that root in there tells us that the origins of this area of study came from treating skeletal problems in children. So we have two different types of fractures, and the first is a stress fracture, and this is not how athletes use the term stress fracture. Okay, so our scientific term here is different from how we use this in regular conversation. The other is a pathologic fracture. Okay, let's start with pathologic fracture because that's a bit more clear for us in terminology. A pathologic fracture happens because bone is already weakened. Okay, so if a person has bone cancer or osteoporosis and then experiences a bone fracture, that would be a pathological fracture. Whatever stress happened would not have fractured the bone of a healthy individual. So the opposite of that, if the person doesn't have any bone disorders, all other types of bone breaks are called stress fractures. Okay, now again, this is different. If you ran cross-country or long-distance track events in high school and you had stress fractures from repeated injury and bone inflammation, that's more of an athletic medicine term. It's different than here how we're using stress fracture. So we have several different ways that we can classify fractures, and we're going to talk about those now. All right, so non-displaced means the bone is still intact. It does have a fracture in it. It does have a crack, but the bone itself is still intact. In a displaced fracture, the pieces of the bone have shifted from their original positions. A comminuted fracture is when the bone is split into multiple pieces. And a green stick fracture is where we can see a fracture on one edge, but not on the other edge of the bone. And this often happens in younger children. So we have 4 steps to healing a fracture. The first, we have a hematoma or a bruise that is formed. And the hematoma is then converted to granulation tissue, and we have the beginnings of blood capillaries being formed. Then we have a soft callus formation. So this is when collagen and fibrocartilage get deposited, and those are going to convert the granulation into a soft callus. Then a hard callus forms, and osteoblasts come in to deposit a temporary bony collar. And finally, bone remodeling. The small bone fragments that are in the wrong place get removed by osteoclasts, and the osteoblast's spongy tissue is converted to compact bone. When we're treating fractures, there are a couple different things that we can do. We can do a closed reduction, and that's where the pieces of bone are manipulated back into their normal positions without any sort of surgery. An open reduction means that we're going to do a surgical procedure, we're going to expose the bone, and then manipulate the pieces back into place, sometimes with the assistance of plates or screws or pins, to keep everything aligned where it needs to be. And a lot of times we'll use a cast that stabilizes and immobilizes the bone as it heals. Some fractures require traction, which is using mechanical force to work against the direction that the muscles want to pull the bones. And if the femur of a child is fractured, traction may be required to realign the bones. When older adults have a fall and experience a hip fracture, a lot of times those are treated with open reduction, and pins are used, and the person is then encouraged to walk as soon as possible so that the healing process can start as soon as possible. So this is an example of an X-ray following an open reduction procedure. So I think everyone has probably heard of osteoporosis. It's the most common bone disease that we talk about, and we see osteoporosis when bone density is lost. Bones lose mass and consequently become brittle as that organic matrix and then the inorganic minerals, as that complex breaks down, can lead to severe fractures, and these would be pathological fractures because an underlying disease led to the fracture. We can also see spinal deformities. I'm sure you guys at some point have seen an old lady who is slouched forward and appears to have a hump on her back. This is osteoporosis manifesting in the vertebral column. Once a person has severe osteoporosis and their mobility is limited, they're more likely to get diseases like pneumonia or thrombosis. Both males and females produce estrogen. Males produce more testosterone than estrogen, but they still produce some estrogen. And that estrogen is very helpful in maintaining bone density. It does that by inhibiting osteoclasts from resorbing minerals. Once a woman is postmenopausal and her ovaries cease to secrete estrogen, she's likely to start losing bone mass. By age 70, the average white woman has lost more than 70% of their bone mass. There are some risk factors here that could make osteoporosis more likely, and they include smoking, having diabetes, not getting enough calcium, vitamin C, or vitamin D in the diet. Also, osteoporosis can be seen in young athletes who have a very low body fat, and if they stop menstruating and stop ovulating because their body fat is very, very low, they can develop osteoporosis at a very young age. So osteoporosis can be treated with estrogen replacement therapy that would slow the bone resorption, but it comes with a risk of increased cancer incidence, stroke, and heart disease. We have some fairly new drugs that inhibit and destroy osteoclasts, and we can also give parathyroid hormone as an injection to slow bone loss. The best way to prevent osteoporosis is for women to get plenty of calcium in their diet prior to age 40, and also do weight-bearing exercise, lift weights, that would help their bones to be remodeled to their strongest. Here's a picture of some normal spongy bone tissue and spongy bone tissue that has osteoporosis, and you can see how much less dense this tissue is.